Chris Romandetti, First Choice Healthcare Solutions, owns medical facilities in Florida. These are non-physician owned facilities. Why do you think this is the future of healthcare?
Well, over the last few years, many doctors have had an alternative to either give up their practice in the orthopedic space and join a hospital. And we think we're an alternative to that, meaning let us take the burden of the back of the house operation and allow a doctor to be a doctor.
And how does this improve service for the patient? Because, that should be the end result.
Well, the continuity of care in our model is that we bring all aspects to one location. So the diagnostics, the physical therapy, the MRIs, the DME, everything that it takes, including the surgery center, is done under one care, one roof, compared to having to drive all around to experience different locations with different service levels.
And does it save on cost? Because Obamacare really is the Affordable Care Act. So the end goal is to reduce costs. Does this do that?
Well, I think the future will bear results, and history will describe that to be seen. But the fact is that currently, right now, if you have to go to 5 locations to get 5 services, we definitely feel it's more costly to do it under one roof.
And currently, a lot of independent practitioners, doctors, are selling out their practices to large healthcare organizations, hospitals in their areas. Is this going to stop that trend? Is this going to take it another way?
Well, it's estimated 40% of the orthopedics over the next 3 years will leave private practice and join hospitals, retire, or we hope to intercept some of those doctors and join an outfit like ours. But I think mainly what you're seeing is a doctor that's really been trained to be a doctor, and in today's world he has to be a business person, and it's very frustrating for them. So yes, I do think that the ones that are choosing the hospital as an alternative place to go is just looking to get a check, put in 5 more years and leaving. And we're hoping that we can still have that doctor that has that entrepreneurial feel to say, if I work harder, I should get compensated more. And that's what we're offering them, is an alternative place with great care.
When you hear the candidates on the campaign trail talk about taking away Obamacare, or repeal and replace, or whatever they plan to do with it, or strengthen it, or scrap it, whatever they plan to do with it, how does your system jibe with Obamacare now, and then some of the things you hear on the campaign trail?
Well, Obamacare to us right now has been great. That has offered millions and millions of people insurance that we've seen that haven't had the opportunity. When I hear repeal, I hope they definitely, in the same sentence, say replace. Do I think there should be a more competitive marketplace to offer more affordable health care to everybody? Yes. We're working fine with the system that's in place now. And my opinion is the future will go to a bid price, to a bundled payment. And today it's very, very fragmented. I mean, we hear numbers in the Wall Street Journal that are almost $70,000 to replace a hip. Our doctors only get approximately $1,500 of that. So there's way too much money being spent in wasted areas right now. So there's a tremendous area of savings that's offered that I think needs to be capitalized on, and I think it needs to be put out to a competitive bid to achieve that.
All right, and then finally, right now you're operating in the northeast part of Florida, the Space Coast. Talk about your growth plans.
So currently, like you said, we're on the east coast of Florida, and we're looking currently that we've discussed to expand in Florida. We like subsidiaries of Jacksonville and Sarasota, and within the central parts of Florida, and possibly up into the Atlanta area. But again, our particular business model is orthopedic surgeons assembling 8 to 10 doctors and trying to intercept those that are just ready to put their hands up and join a hospital.
All right, well, thanks a lot for coming on and talking about it, Chris.
Thank you very much. Pleasure.
And thank you for watching The Street.